Hello, this is Dr. Mukhtar Yerima. Welcome back to my channel. Today, I'm going to talk about another interesting type of anxiety disorder that is called agoraphobia. Agoraphobia is another interesting type of anxiety disorder in which the individual who suffers from this kind of condition experiences anxiety only in some particular situations, and those particular situations include places that are crowded, places in which they feel confined, and places in which they feel they are far away from home. So these are the kind of categories of conditions or situations that bring on the anxiety symptoms. So crowded places include shopping malls, they include marketplaces, supermarkets. Confined places include maybe a movie theater. Generally, the kind of situation that brings on this anxiety are situations in which they feel escaping from these situations might be an issue. So escaping might be an issue and kind of not escape easily without attracting attention to themselves, essentially. So these are some of the examples. So also traveling away from home is an issue. So if they find themselves in a public place or in public transport, or when they find that they are generally far away from home, they tend to have all these kind of symptoms of anxiety. Agoraphobia is derived from two words, agora and phobia. Agora is a Greek word for an open space. In ancient Greece, they used to have open spaces, kind of public spaces where citizens can go and maybe discuss, interact, and talk about a lot of myriad issues. So they are public places. And because a lot of people might want to go and discuss a lot of things, the places might potentially get crowded. And so people who have agoraphobia tend to experience their fear tend to experience their anxiety if they go to such places. So, and that's how this disorder gets its name. So essentially, these are the situations. So what are the symptoms? The symptoms that occur in agoraphobia are not much different from the other anxiety disorders that we've talked about previously. So for instance, the situation that brings on these anxiety symptoms are marketplaces, crowded shopping malls, traveling away from home, finding themselves in a confined space, such as in the center of a movie theater, or any of such places where they feel confined, or where they find that they are far away from home, or they are traveling away from home, or they are in crowded public spaces. Now, when they are in any of these situations, they may experience some or most of the anxiety symptoms that we've talked about. Now, these anxiety symptoms include that fearful anticipation, that frightfulness, that feeling dread, that kind of fear generally that comes into their mind. In addition, they also experience those bodily symptoms that we've talked about. Those symptoms suggestive of physiologic or autonomic arousal, such as palpitations, where they get aware of the beating of the heart, where their hearts are beating fast, where they have trembling, their mouths are dry, where they feel dizzy and lightheaded, where they experience tingling sensations, their bodies are aroused, their minds are aroused, they're feeling restless. So all those are the symptoms that occur in those situations. Additionally, there are what we call anxious cognitions. Remember, in social anxiety disorder, we said that at the back of the mind of individuals who have social anxiety disorder is that they are afraid of being evaluated negatively. Whereas in this agoraphobia, what is at the back of their minds is essentially fear of losing control. Essentially, they do not want to lose control in a situation that is far away from where they could potentially get help. So for instance, they don't want to lose control, or they don't want to do something embarrassing and it is far away from home. So these are some of the things that are going through their minds, and these are some of the so-called anxious cognitions. So these are some of the things that go on in the minds of the people who have agoraphobia. Another thing that can happen in people who have agoraphobia is panic attacks. Usually, in fact, the first thing that happens when they first have their symptoms of agoraphobia is usually a panic attack in a public space, in a crowded public space. So all of a sudden, out of the blue, without any warning, they experience the severest anxiety that they've ever experienced, and they are afraid that they may die, or they may lose control, or they may go mad, together with very severe anxiety symptoms such as palpitation, dryness of the mouth. They are having difficulty breathing, having a choking sensation, their chest is paining them. All those severe sudden onset of anxiety symptoms is what happens in most people who have agoraphobia in a public space. So again, these are unique things that occur in agoraphobia, having a panic attack in a crowded space. There is also the presence of anticipatory anxiety, in which the individual, before he even ever goes to the open space or any of those places where he experiences the anxiety, he begins to feel dread. He begins to have anxiety. So presence of that anticipatory anxiety is also a significant symptom that occurs in people who have agoraphobia, and that is also something that is seen in social anxiety like we've discussed previously. Another very important finding in agoraphobia is the presence of avoidance. People who have agoraphobia tend to avoid any of the situations or conditions that bring on their anxiety. So if it is crowded shopping malls, they hardly go there. If it is traveling alone or away from home, they would not want to do that. However, people who have agoraphobia, when they go to any of those places with somebody, a familiar individual, a family or a friend, or even a pet, it's been found that it significantly reduces their anxiety, and that makes it a situation in which they now become dependent on somebody. So this is a problem, right? You may find that your symptoms are improved, or you do not experience, in fact, the symptoms at all if you go with somebody who you know, but that is making you incapable of independent living, so to speak, because you depend on somebody or something for you to be able to go about your normal day-to-day activities. But in fact, this is a significant finding in which they have avoidance, and if they are to face those feared situations, then they would want to do that with somebody, because doing that with somebody reduces that anxiety symptoms. Now, in some people, they in fact continue to avoid those situations until they are completely unable to go anywhere at all, because going out alone, traveling alone, finding themselves in a crowded space, so they cannot go to a market, they cannot go to a shopping mall, they cannot travel. So they continue to avoid those situations until they are completely unable to go anywhere. They remain completely at home until they become completely housebound. And in fact, there's this concept of housebound housewife syndrome. And one of the things that can cause that is agoraphobia. They cannot go anywhere. Now, this is completely different from what we find in social anxiety, in which the person is only afraid of social interactions, and in fact close social interactions in which they feel closely scrutinized, closely observed. Whereas in agoraphobia, any place where it's an open space, where it might be crowded, where they feel confined, or where they feel away from home, it is a situation that can result in these agoraphobic symptoms, and these are situations that they continue to avoid until they are unable to go anywhere. So you can imagine the level of distress that can come as a result of even the avoidance, not just the symptoms themselves. So, and then also imagine the level of incapacitation, the level of impairment that can come from this. You are unable to travel, you're unable to therefore go to work, you're unable to go to places, you may not go for your groceries. And essentially, you find yourself completely housebound, and that is very significantly impairing. As a result of all these symptoms, and as a result of the distress and the disability that this condition can cause, it is not uncommon for patients with agoraphobia to have other conditions, other emotional and psychological problems. One of them is the possibility of having a depressive episode. So usually when a person comes with agoraphobia, it is prudent to evaluate for depression in addition to having these anxiety symptoms, and that is actually what we do in the hospital. So when a person comes with agoraphobia, we tend to see whether they also have depressive symptoms as well. Also, we tend to evaluate for other disorders, other anxiety disorders, in addition to the possibility of having a depressive illness. So we do all those evaluations, and then there are effective treatments. These treatments can be in form of medications, and they can be in form of psychological interventions. Treatments include medications that include what we call SSRIs, selective serotonin reuptake inhibitors. These medications are found to be effective for a number of anxiety disorders, and they are also used for the treatment of depression. There are also psychological treatments that include what we call cognitive behavioral therapy, and it is actually a very effective form of treatment. So by and large, these are some of the things that we need to talk about in agoraphobia, which is also a type of anxiety disorder. So that's it for now. See you another time.